Hello everyone, I welcome you all to this channel and to this 17th episode of Third Nursing Officer exam. In this video, we will discuss some of the MCQs related to obstetrical nursing, and the questions here are mostly applied questions. I hope you will benefit from this video, and kindly watch this video and understand the questions and do not skip the video so that you won't miss any important concepts. Question number 1. A client has obtained levonorgestrel 0.75 mg 2 tablets as emergency contraception. After unprotected intercourse, the client calls the clinic to ask questions about taking the contraceptive. The nurse realizes the client needs further explanation when she makes which of the following response. Option A, I can wait for 3 to 4 days after intercourse to start taking this to prevent pregnancy. Option B, my boyfriend can buy Plan B from the pharmacy if he is over 18 years old. Option C, the birth control works by preventing ovulation or fertilization of the eggs. Option D, I may feel nauseated, breast tenderness, or headache after using contraceptive. So here the correct option is option A. That is, if the client makes this statement, I can wait for 3 to 4 days after intercourse to start taking the medications to prevent pregnancy. If the clients make these statements, the nurse should realize that the clients needs further explanation because levonorgestrel is more effective if taken immediately after unprotected intercourse, or the first dose of 0.75 mg to be taken within 72 hours from the time of unprotected intercourse, and the second dose should be taken 12 hours after the first dose, 0.75 mg. Or this levonorgestrel can also be taken as a single dose of 1.5 mg. And this Plan B is the brand name for levonorgestrel, or also called emergency pills. And this birth control pills works by preventing ovulation or fertilization of the eggs. And when taken, the client may feel nauseated, or the side effects of levonorgestrel is nausea, breast tenderness, or headache. Question number 2. An antenatal of G2, T1, P0, A0, L1, client is discussing her postpartum plans for birth control with her healthcare provider. In analyzing the available choices, which of the following factors has the greatest impact on her birth control options? Option A, satisfaction with prior methods. Option B, preference of sexual partner. Option C, breast or bottle feeding plans. Option D, history of clotting disease. So the correct option here is option C, that is breastfeeding or bottle feeding plans, because birth control plans are influenced primarily by whether the mother is breastfeeding her baby or bottle feeding her baby. And before starting these hormonal birth control methods, the maternal milk must be well established. So the the factors which has the greatest impact on birth control option is breastfeeding or bottle feeding plan, whereas the history of clotting disease comes as a second most important factors in her choice of birth control options. Question number 3. After the nurse instructs a 20 years old nulligravid client on how to perform breast self-examination, which of the following client statement indicates that the teaching has been successful? Option A, I should perform breast self-examination on the day my menstrual flow begins. It's important that I perform breast self-examination on the same day of each month. If I notice that one of my breasts is much smaller than the other, I shouldn't worry. Option D, if there is discharge from my nipples, I should call my healthcare provider. So the correct option here is option D. That is, if the client's statement is, if there is discharge from my nipples, I should call my healthcare provider, it indicates that the client has understand the breast self-examination successfully, because if there is a discharge, or if the clients notice there is discharge or any bleeding from the nipples, that may indicate or it's the symptoms of some of the underlying disease. Whereas option A, I should perform on the day of menstrual cycle. Usually BSE or breast self-examination should be performed after 1 week from after the menstruation, 1 week after the menstruation, because at this time the hormones is at the lowest level. And option B, it's important that I perform BSE on the same day of each month. That also is correct, but sometimes the menstrual period differs, so maybe on the day she should perform her BSE, we might be on her menstrual flow, so she can skip it. It's not very important to do on the same day of each month. And number C, if I notice that one of my breasts is smaller than the other, I shouldn't worry. Usually right breast it's little bigger than the left breast, but if one of her breasts is much smaller and the other is much bigger, and also there is like some kind of pitting edema and all, so the client should worry about that may also indicate some of the underlying disease. So the correct option here is option D. Question number 4. An assessment of a 16 years old nulligravid client who visits the clinic and asks for information on contraceptives reveal a menstrual cycle of 28 days. The nurse formulates a nursing diagnosis of deficient knowledge related to ovulation and fertility management. Which of the following would be important to include in the teaching plan for the client? Option A, ovum survive for 96 hours after ovulation, making conception possible during this time. Option B, the basal body temperature falls at least 0.2 degree Fahrenheit after ovulation. And option C, ovulation usually occurs on day 14 plus or minus 2 days before the onset of next menstrual cycle. Option D, most women can tell they have ovulated because they have severe pain and thick scant cervical mucus. The correct option here is option C, that is ovulation usually occurs on day 14 plus minus 2 days before the onset of next menstrual cycle. For a client of 28 days, the ovulation usually occurs on 14 day plus minus 2 days before the onset of menstrual cycle. Whereas the ovum survive for 12 to 24 hours after ovulation, which makes it possible for conception during this time of 12 to 24 hours, and the body temperature usually rise about 0.5 to 1 degree Fahrenheit after ovulation. And some of the women may have this pain or discomfort during ovulation, which is called Mittelschmerz. And usually after ovulation, the cervical mucus is thin. Mucus is thin and copious. So the correct option is option C. Question number 5. After conducting a class for female adolescents about human reproduction, which of the following statements indicates that the school nurse teaching has been effective? Option A, under ideal condition, sperm can reach the ovum in 15 to 30 minutes, resulting in pregnancy. Option B, I won't become pregnant if I abstain from intercourse during the last 14 days of my menstrual cycle. Option C, sperm from healthy male usually remain viable in the female reproductive tract for 96 hours. Option D, after an ovum is fertilized by sperm, the ovum then consists 21 pairs of chromosomes. The correct option here is option A. Under ideal conditions, sperm can reach the ovum in 15 to 30 minutes, resulting in pregnancy. This is the correct option, and this is the most important points to be made with adolescents who may be sexually active. Question number 6. A 20 years old nulligravid client expressed a desire to learn more about the symptothermal method of family planning. Which of the following would the nurse include in the teaching plan? Option A, the method has a 50% failure rate. Option B, couples must abstain from coitus for 5 days after the menses. Option C, cervical mucus is carefully monitored for changes. Option D, a male partner uses condom for significant effectiveness. So, what is this symptothermal method of family planning? The symptothermal method is a natural method of family planning or fertility management that depends on knowing when the ovulation had occurred, and this symptothermal method requires daily basal body temperature assessment and also close monitoring of the cervical mucus changes, and the failure rate is around 10 to 20%, and abstaining from coitus after abstinent from coitus after 5 days of menses is unnecessary because it is unlikely that the ovulation will occur during this period, and uses of condom uh, helps in the effectiveness of this method, but most of the partners who choose this natural family method, they often avoid uses of chemical or barrier methods. So the correct option here is option C, that is the nurse should include cervical mucus monitoring. Question number 7. Before advising a 24 years old client desiring oral contraceptives for family planning, the nurse would assess the client for signs and symptoms of which of the following? Option A, anemia. Option B, hypertension. Option C, dysmenorrhea. Option D, acne vulgaris. Correct option here is option B, that is hypertension. Before advising a client about oral contraceptives, the nurse needs to assess the client for signs and symptoms of hypertension. The clients who have hypertension, thrombophlebitis, obesity or family history of stroke or cerebrovascular accidents are poorly candidates for OCP or oral contraceptive pills or oral contraceptives, and anemia, dysmenorrhea, and acne vulgaris are not the contraindications for oral contraceptives. Question number 8. A 22 years old nulligravid client tells the nurse that she and her husband have been considering using condoms for family planning. Which of the following instructions should the nurse include about the use of condoms as a method for family planning? Option A, using spermicide with the condoms offers added or extra protection against pregnancy. Option B, natural skin condoms protect against sexually transmitted disease. Option C, the typical failure rate for couples using condom is about 25%. Option D, condoms users commonly report penile gland sensitivity. The adding spermicides with the condom can decrease the potential failure rate because it offers extra protection, and the typical failure rate of couples using condom is about 12 to 14%, and the natural skin condom does not protect against sexually transmitted disease, unlike latex condom, and the condom users commonly report the decrease penile gland sensitivity. So the correct option here is option A. The nurse should include in her instruction that using spermicides with the condom offers extra protection against pregnancy.